Hello all. Today we'll discuss about the care of central line. First of all, let's see what is a central line. A central line or a central venous catheter, which is also called a CVC, and central venous line or central venous access catheter. This type of catheter which is placed into a large vein. It is a form of venous access like an IV cannula, but it is placed into a major vein. The placement of larger catheter is more centrally located veins, and this is needed for some critically ill patient or the patient who requires intravenous therapies or for more reliable vascular access or maybe due to some conditions. The central line catheters are commonly 15 to 30 centimeters in length and which is made of silicone or polyurethane and have a single or multiple lumens. So this is a central line catheter. This is a triple lumen catheter, and according to the needs we can use single, double, triple or 4 lumens even. Nowadays it comes with antibiotic coated also. According to the need of the patient, doctor will be deciding which catheter is used for the particular patient. This is a central line like this will be placed. This is a single lumen central line which is placed into a subclavian vein. This will be the catheter tail and cap, and this is a single lumen catheter, and from this place it is like outside the body, and from here it will be inside the body, and it is going into the right atrium of the heart. The tip will be in the right atrium or just above the right atrium. Now let's see sides of CVC placement. Which side we will be preferring to put a central line. First one is internal jugular vein. Next is chest or subclavian vein or axillary vein. Then groin. In groin we'll be preferring femoral vein, and veins in the arms, which is usually used to prefer PIC catheter, which is called as peripherally inserted central catheter. It is same like a CVC, but it will be long. It can be inserted through peripherally. So this is the picture of sides of central line. First one is a femoral catheter, and second one is a subclavian, and the third picture is a internal jugular vein. Now let's see the indications in the sense why we need to place this central line catheter. First of all, as usual, to administer medication, blood products and fluids. Next one is long-term IV therapy. Medications would harm peripheral vein. Medications such as high concentrated sodium chloride or potassium chloride or chemotherapy medications which may irritate the peripheral veins. So it is advised to prefer central line. To administer TPN. TPN is total parenteral nutrition. Then obtain frequent blood test. Central venous oxygen saturation. Then large volume resuscitation, like the patient, suppose if the patient is in burns who needs a lot of fluid, or the patient is in severe shock or hypertension, we need to push some blood or fluid, whatever it is, so we'll be considering central line. Then peripheral skin infections or conditions, like any skin infection or some burns or conditions where we could not put a peripheral line, we'll be going with a central line. Now let's see how to put a central line. First of all, the nurse's responsibility is to arrange the article. First of all, CVC catheter, which should be appropriate to the patient, like how many lumens, which should be decided by the doctor. Then PPE, personal protective equipments like gloves, mask, all these things. Now skin preparation solution. When you are using skin preparation solutions, you have to check the chlorhexidine percentage in that. It should be always 2% of chlorhexidine. The hand rub which we are using for rubbing the hand is 0.5% of chlorhexidine, which should not be used as a skin preparation solution. Please consider 2% of chlorhexidine solution to prepare the skin. Now sterile CVP set. Sterile CVP set should at least contains 2 bowls, 1 artery forceps, curved artery, straight artery, sponge holder, needle holder and scissors, then a whole towel and drapes to cover the patients. Then we need syringes of 5 cc and 10 cc's, then local anesthesia, maybe 2% of lignocaine, and suture of appropriate size, sterile transparent dressing which is mandatory, then ultrasound machine, sterile ultrasound probe cover and a normal saline. This is the main articles to be arranged. Now let's see the procedure. First, patient is assessed by a relevant lab reports such as platelet counts, INR and all. So if it is okay, we can consider to put a central line. Then position the patient according to the site which we have selected. We have to position the patient like that and clean the area of skin over the planned insertion site where you are going to insert the line. We have to clean the area with a chlorhexidine of 2% solution. Local anesthesia should be considered next, and location of the vein is identified by landmarks or with ultrasound device. Nowadays it's mandatory to use ultrasound device to confirm the position. The needle is then inserted. After inserting the needle, a blunt guide wire is passed through the needle. Then the needle will be removed and the guide wire will be in the position. A dilating device may be passed over the guide wire to dilate the skin. After that, they'll be removing the dilating device and then the center line will be inserted over the guide wire. After placing the center line, the guide wire will be removed and it is mandatory to aspirate and flush all the lumens. The position should be confirmed with an ultrasound machine and it should be sutured. Then an X-ray should be performed to reconfirm the position of the center line. Now let's see the complications which can happen due to this center line. First and foremost thing is pneumothorax, and with the help of X-ray we can identify whether there is pneumothorax or no. The next thing is vascular perforation, then catheter related bloodstream infection, CRBSI or CLABSI, central line associated bloodstream infection, then occlusion of the lumen or misplacement of catheter, then venous air embolism. These are all the main complications associated with this central line. Here comes the most important part, that is the care of central line. Let's see how to care it. First of all, it should be always covered with a sterile transparent dressing. A dynoplaster or some other plasters which will not allow the visibility of the catheter, so it is not advised. Cover the lumens always with a sterile towel. Don't allow the lumen to lie on the patient bed or pillow. The gaps of the central line in a sterile condition. Before touching, it is mandatory to wash the hands. After giving any injection or any medications, it is mandatory to flush with NS. And always maintain the CLABSI form. Meet all the criteria which is given in the CLABSI form. So this is all about a central line. I hope you have understood this video. If you have any doubt, you can always comment below. And please don't forget to subscribe this channel. Thank you.